My name is Matt Broadway-Horner and I'm the Clinical Director of CBT in the City Clinics. Part of my role is that I'm a consultant cognitive behavioural therapist, and in that we have three strands to the business. So the first strand is looking at treating people with obsessional problems, anxiety, depression and trauma. And the second strand is working with corporate business, so providing workshops like stress management, how to overcome procrastination, anger management, self-acceptance. And then the third strand is the work that we do with schools. So I'm the project leader for the CBT in the City Schools project, which actually goes out into schools providing a lesson pack for children in Year 5 and Year 7. So in this lesson pack we actually talk about issues around confidence, problem solving, how to deal with difficult issues, and with the whole aim of reducing difficulties within school, like bullying, for example, which we've had a marked success rate in reducing. But back to the therapy side of things, what we actually tackle is we treat problems like obsessional compulsive disorder, body dysmorphia, vomit phobia, health anxiety, generalised anxiety disorder. So things like worry, preoccupation, rumination, typical problems like that that are part of the disorder is what we look at treating in order to reduce the problem. In order to land in this position, I've been practicing as a cognitive behavioural therapist for many years, and I've worked both in the NHS and the private sector. I started off as a mental health nurse, and then worked in various sections within the NHS, and all of them have been therapy posts. So you get internal training and looking at psychodynamic training, and that's basically what we started off with, and working in therapeutic communities and working in a group therapy program. So there was lots of things that we did at an early stage, and this is a good kind of 20 years ago, looking at providing group therapy for people with psychosis, anxiety problems, relapse prevention, relaxation classes. When we moved into the therapeutic communities, it was very much looking at long-term issues like self-harm and other difficult issues like that, which the people would be in treatment for at least 6 months. My interest then turned into more cognitive psychology, and so I retrained doing psychology course and looking at doing a master's in cognitive behavioural therapy, with the aim of looking at what interventions are out there to be introduced to individuals but didn't take as much time, because 6 months is quite a long time, and this was what was on offer in the NHS. And so I began to look into the area of CBT and looking into other approaches. So there's dialectical behavioural therapy, which helps to treat people with self-harm, borderline problems at a very reduced time, and you get quick results within 6 weeks. So this is where, with CBT, there is the banner of CBT. Under that banner, there's lots of approaches. There's mindfulness, there's acceptance and commitment therapy, there's compassion-focused therapy, there's imaging and rescripting. So all of these are approaches within the CBT tradition, if you like, and they have a huge impact on lots of different problems. So phobias, obsessional problems, depression, trauma, childhood trauma, bullying, and these are all very difficult problems for the individual, and CBT is very effective in treating those problems. So what is CBT? CBT, in a nutshell, is about understanding negative automatic thoughts and how they create self-defeating behaviours and difficult emotions. So that's it in a nutshell. When we're actually working together with you, the problem will be collaborative. So when we're looking at assessing the problem, we'll be treating the problem in a collaborative way. Because what's important is to get it from your perspective and see the problem through your eyes. And then I can bring in my expertise. So it's 50-50, understanding your condition, but also looking at the theory and how and where I can take you to. So needing your subjective experience, needing the objective experience of theory and science, and with those two things together, we're bound to get a good and successful outcome. I guess for me, through seeing a relative who was struggling with manic depression and seeing them growing up and watching them kind of not getting the help that they needed and deserved, it's almost like it was treated too late. And I think if it was treated a lot sooner, then the problems wouldn't have been so difficult, whereby they had to leave work and it became a chronic situation. I don't think the future for mental health is about being sat in a day centre somewhere. I think it's all about encompassing the idea that we all have difficulties at one point or another, but let's just seek help and let's fit it in to what we all do ordinarily. So whether it be a parent, working full-time, setting up a business, all those normal, everyday things that we all want to aspire to, if you have a problem, why not just seek help for it, and so that you can continue living your life as fully as you want to. So that's basically where I'm coming from, is to not let it build up so bad in a chronic sense, but seek the help sooner, and then you can enjoy a better quality of life.